So, for the last couple months, I have been building a simple tool for doctors. It's called Clinic. Clinic is simple, straightforward appointments, tasks, and messages for doctors. I've been working on kind of a paradox, or at least what a lot of people perceive as a paradox. And that is the difference and the kind of coexistence, I guess you could say, of a simple experience and a complex experience. Something that has so many variables and so much information and so many different things that it can be hard to reduce to something simple. And I think this is one of the kind of preeminent challenges with EHRs in general. And actually, there is kind of a law, UX law about this. It's called Tesler's law. Tesler's law basically states that at a certain point, most systems have a certain amount of complexity that you just cannot reduce. And generally speaking, when we think about simplicity, we think about reducing. We think about having fewer elements on the screen. We think about having less information to make decisions with, or the information maybe is structured in a way that removes certain things. And when I talk to doctors about what they're looking for with simplicity, and when they say, I want something simple, and I kind of dig into that to kind of figure out what that means, generally speaking, their concerns fall into a couple different camps. And that generally means fewer things on the screen. I don't want to see all these things. Generally, it means like faster interactions. I want things to happen more quickly when the system responds. But it can also mean quicker as in fewer clicks, fewer numbers of screen transitions or fewer menus or things like that to get through and dig through. But they also might say things like, and kind of allude to wanting a more consistent information architecture, or an information architecture that speaks and works for the workflow or information they're looking at that point in time. But when we talk about complexity, generally speaking, we're talking about not removing things. And that's where we get Tesler's law, where there's a certain amount of stuff that you just cannot remove from a system. But what I've been working on with Clinic is how do I kind of balance these two things? Where it's kind of like a scale. Like, how do you kind of make them evened out to the point that your users are satisfied with how much is on the screen and how much, they can, how few clicks they can do and all that kind of stuff, but also to make sure that they can actually do their jobs. Today, I want to talk a little bit about the design system that I've created to kind of facilitate this balance, or at least what I think might be the foundation for that design system. So to give kind of an idea of where we were, this is one of the last things that I kind of made in this old system. And this is not terrible design. I think we're actually dealing with a fair amount of information density here. But one of the things that really stood out to me about this is that it's not very clear when it comes to managing this kind of power. Is one of the things that's really obvious to me is, what do I do next? What's the next thing to do here? And this screen, this experience does not present that very well. We might have like, oh yeah, there's like these tiny little buttons in the bottom, review chart or write note, or maybe look at a certain thing that happened recently or something like that. But beyond that, it doesn't really give me a lot of indication, and it doesn't really give a lot of users the indication of what's next. And so when I showed this to users, I would get a lot of kind of confusion, or kind of like, okay, kind of like a lackluster kind of response to it. So what I've kind of gone to is a new system of blocks. And these blocks are designed to hold the state and the actions of the thing. And again, like I say, I probably haven't nailed it quite yet either, but I think I'm a lot closer now than I was. So for one thing, I have removed the sidebar. So now when you kind of get into an item, an appointment or a task or something like that, I've removed the sidebar, except for a very important exception, which we'll look at in a second. And I have essentially given the user two kind of areas: the kind of work area for what they're interacting with and what they're doing right now. And then on the side is essentially a sidebar, essentially kind of a condensed patient chart with a bunch of information in it. And the goal there is to present as much information as possible to the user about the patient without overwhelming them. So using typographic hierarchy, color hierarchy to present information in a way that is hopefully somewhat digestible and gets them to a thing a little bit more quickly at a glance, rather than trying to give them a bunch of information all at once. One of the things that right here, this system would not facilitate that very well. So this is essentially a newer system to do that. Now, the really important thing here is these blocks in the middle. Now, these blocks essentially are the work surface, if you will, for various parts of this workflow. So with an appointment, there are generally a couple things that are going to happen. There's going to be a consult, there's going to be the intake, there's going to be some coding and billing that has to happen. And that consult is going to include things like the note, the chief complaint, the plan, orders, all that kind of stuff is going to go into that consult section. And so what I've kind of started working through here with these blocks is a way to capture a part of the workflow that feels natural, hopefully, and feels cohesive and consistent, and gives the user the control to do the things they need to do. So this consult block or these coding blocks can kind of adapt and change depending on the information that's present. So if we have a chief complaint already started, then we can know that, hey, we can write that in. If we don't have a plan yet, that's okay. We don't have that information present, but we can still present the state for that. And this is, and then when you kind of have a plan, then you can show those items kind of in a list, right? And the visual design here isn't quite as important as the idea that this block is actually kind of containing the piece of that workflow, the kind of the power of that workflow, all within a specific area. It might require a screen transition or two, depending on what the block is and depending on what the workflow might entail, but it doesn't require as much, hopefully, cognitive overload to get a sense of what am I supposed to do here? What is the current state of things? And then what is my next step? And that is kind of the idea with all these blocks. So even like within a task, there might be things like the activity feed, shortcuts, commenting. All of those things live underneath this kind of consistent header. Again, that's editable. That has kind of the main controls for the item. A message might be a little bit different because it shows maybe like a more of a traditional inbox experience, but we might still have some similarities in terms of like how to do an input for writing a message. There's a lot of things that could even be consistent here with bringing over some of these blocks into this area, like an activity feed, maybe even like if we can code and bill for particular messages, portal messages like that might work its way in here at some point in the future. But we've already got the system for coding down, and we know that we can pretty much pretty easily add things or remove things from this coding block as needed. And we can actually add in other interactions like pluses, ways to add codes into this and do those inputs kind of in line without having to start a whole new kind of workflow or new screen transition or whatever it might be. And even the same with a bill, and I think this might be the first time I've ever showed something like this on the channel, which is, having payments, having the appointment summary, which is something I've never really thought about, but like more of like the appointment summary from an admin perspective, which is things like the appointment type, the date of service, the patient ID, maybe an ID for the appointment in general, diagnosis codes, services and procedures codes, which would be things like, the ICD-10 codes, the CPT, the HCPCS codes, all of those different codes might work their way in here. And then also, again, providing like the actions for the patient bill. We're going to send the bill to them. We're going to accept a payment for the bill. We're going to send the claim to the insurance company. And all of those things, I haven't worked out exactly how they're going to function yet, but all of those things are contained here, but also might, be able to be completed kind of in line without having to go to other areas. So the thing, and I think this is kind of important here, the biggest change for me coming out here is thinking about all of these kind of disparate actions, not as individual features, which is what I have done in the past. I've been very guilty of this in a lot of different projects that I've worked on, but as essentially pieces of a whole, different types of workflows, different types of information, but all kind of related to the same thing, which is kind of interesting, right? So like this patient sidebar is present pretty much everywhere this patient information is present. And it gives the user the same information about active conditions, their recent events, their medications, those kind of major things that a physician might need to know. Even things like the MRN, the date of birth, insurance company, might even be things like eligibility or contact information. All of those things will be available to the physician or any user really, depending on the context that they're in. And those things then are kind of the jumping off point, hopefully for more other workflows, which again, haven't quite worked out yet, but I think will be easier to reason through with this system. Now, to give you a sense of what this looks like in practice, I've kind of got it built into, I've got the appointments and the tasks built into this prototype. And there's a whole other video I'm going to make about the prototype and the progress I've made here that I'll get into at a different point. But basically you can see here that, for the note, we could even just throw a write note button in there, right? Like this big button, and then you hover over it and it gets blue. It's like, okay, that's my next step here, right? I've got the vital signs, I've got a chief complaint. I know, this person has been roomed. I can see that up here with this little progress indicator. Okay, let me go write my note, right? And this is really important because this is kind of blending even the power of the administration part of a practice for independent doctors with the kind of clinical part of the practice. And for independent docs who might be working by themselves or have one person on staff, this can be a really important, this is really important information for them to have and know so that they can properly manage their practice and properly work with their patients. Even these things like the sidebar with like the active conditions and medications, like we can present these things and give like even like little hover cards, right? And this is removing some things in practice. We are removing elements from the screen, but we are not removing the power of needing to see that primary hypertension is being treated with lisinopril 20 milligram. And that maybe I need to see more information about that. I can view more. Again, I haven't quite worked out what this is going to do yet, but that's kind of the exciting thing here is like, I could have this kind of slide over. I could have just kind of a module or something slide over on the right-hand side that the user can then X out of. And that gives a much more powerful experience because now they've decided they need to see information about this. But it could also mean that we open the chart in kind of a new window, perhaps. And that might even be something interesting to explore. I've been kind of thinking about an idea called what I'm calling the desk, which would be kind of this kind of agnostic experience that kind of slides up or maybe kind of takes over the screen and gives the user the ability to kind of go through different pieces of the chart without having to go through the chart, if that makes sense, right? They can find different pieces of what they want to see, what they need to make a decision or to understand something. Maybe it's even persistent. They can minimize it. They could close it out altogether. Maybe that state persists, but depending on the appointment. And those things, I think, again, continuing to keep the power and the complexity of those workflows, which can be very challenging depending on what it is, depending on who the patient is, but it doesn't necessarily make the system feel more complex. It doesn't necessarily make the system feel harder to use because it's all presented in a consistent, easy to use way. And that I think really is where it comes down to this kind of discussion between simplicity and power and complexity. So this is what I've been working on. It's been a lot. I'm very excited about this. I think there's so many interesting things here that I didn't even touch on in terms of like the visual design and the hierarchy. If you'd like to hear more about that, I'm more than happy to discuss it. But yeah, I'm pretty excited about this progress. I'm pretty excited about getting it built and been working with physician users already on this and getting their feedback and getting their thoughts about how these things happen, how these things come together. And I think it's definitely got a much more cohesive and I think directional kind of feel to it now than it did before. And I'm excited to keep working on it. I'd love to hear what you think in the comments. If you have any thoughts, if you have any ideas about how this is coming together, what maybe even is missing, what have I not considered here? I'm always happy to hear that and love reading those comments. So I really appreciate you watching. Thank you so much for your support and being here. And I'm really looking forward to making some more videos soon. And yeah, thanks so much.